Hi, my name is Chris Lyon, and we're going to be discussing the Quality Improvement Plan. Without further ado, let's begin. First, we're going to discuss quality methods in healthcare. Lean is the first method. Lean is a program that is based around reducing waste and improving quality. It focuses on creating more value for patients while taking fewer resources. How could this apply to the healthcare setting? It could apply to physicians by helping them find more improved ways to treat patients and reduce the resources needed to do it. The next item we have is TQM, or Total Quality Management. Total Quality Management is based on three principles: CQI, which is continuous quality improvement, customer focus, and teamwork. This process measures outcomes to gauge quality levels. This can apply to management or administration. It gives them a way to gauge quality and helps them improve customer satisfaction. Our next one is Six Sigma. This one focuses on eliminating defects. It is important in healthcare as the defect may be the difference between life and death. This program is focused on patient safety and is popular among nurses. Finally is QI, or Quality Improvement. This consists of systems and processes. The main focus of this quality method is patients, teamwork, and the use of data. This model will measure the level of services to the desired outcomes. This can be applied to any area within a healthcare facility. Our next one we're going to discuss is QI methods in healthcare. Our first item is PDSA. This is a great tool for testing change. It has 4 steps: plan, do, study, and act. In this method, you plan to change an item, carry out a test, observe and learn, and then finally determine if any modifications can be made. Our next QI method is Model for Improvement. This is a tool that is used to enhance current QI models. It asks questions such as, what are we trying to accomplish? How will we know if the change is an improvement? And what additional changes can we make to result in improvement? Next, we have process mapping. This is a workflow diagram that helps bring a clearer understanding of a process. Finally, we have performance benchmarking. Performance benchmarking is comparing internal processes and performance to the industry's best companies. So what is the role of patient experience? Patient experience plays a vital role in the healthcare field. After all, they are the customers of the healthcare environment. A patient's experience will ultimately dictate if they will return and if they will recommend that facility to somebody else or not. Patient satisfaction surveys are given out to give a patient a chance to provide feedback on their experience. These surveys can ultimately be used by a healthcare facility to improve on the quality of service that they provide. So let's take a look at an example survey here. This is a survey that we have been using. It has 3 main categories: facility and convenience, staff, and overall satisfaction. All the other items on this survey are what the patients can rate on a 1 to 5 scale, 1 being poor and 5 being great. Under facility and convenience, there's hours of operation, convenience of location, cleanliness, waiting time in reception area, and comfort while waiting. Under staff, there's explained procedure, questions answered, friendly and helpful, knowledgeable and professional, modesty respected, and confidentiality respected. And finally, under overall satisfaction, there's overall impression of visit, willingness to return, and likelihood of referring to others. So, how do we implement the results of the survey? My best way would be using the QI method that we discussed earlier in the presentation. With using this method, we can even use the PDSA sub-method that we discussed as well. First, we would pinpoint what these issues are that we are having. We would then create a plan to try and correct these issues. Finally, after we tried to implement the plan, we would then take the results and compare it to our desired outcome. Next, we have QI plan application. With a QI plan application, there is 8 basic categories. First is purpose and scope. Purpose and scope is basically, why are we implementing this program? The next item is quality improvement and structure. This is documenting key roles and responsibility for the QI plan. In our QI plan, the quality manager will be the lead for the task force. The other team members of the task force should be made up of medical directors and department managers. Quality improvement projects. Under quality improvement projects, you choose your projects and then you review and prioritize those projects. Goals and objectives. What are we hoping to achieve from this plan? What are the objectives to help us achieve each goal? Next is performance monitoring and reporting. We compare actual results to the plan's goals and objectives. Next is training plan. We engage staff in continuous quality improvement. And then communication plan is recognizing QI efforts and project activities among management and staff. Finally, evaluation. Assess the achievement of the QI plan goals and objectives. Finally, we will discuss how statistics are used in quality methods. The most common source of statistics in healthcare comes from patient quality surveys. This information, which we discussed before, can be used in many different areas of the facility or for any processes. Statistics gives the ability to analyze data to predict outcomes and help mitigate risks. Statistics in Lean are used in determining the amount of waste a particular process has. In QI plans heavily rely on data to help determine issues in a hospital. These statistics can be taken from surveys or even by data recording of a particular item that reoccurs within the hospital. Next, it is important to plot data before doing an analysis. Finally, process control charts are the most commonly used chart in recording data in the healthcare industry. At this time, I ask that if you have any questions, now would be a great time to ask. If not, thank you for your time, and I hope you learned something from these findings that I have shared with you today. Thank you.